Everyone, in today's class, we are going to discuss the most important concept in medical instrumentation, that is the general constraints in design of medical instrumentation system with example. So the learning objective of today's class is that first we will discuss what is the need to get to know the understanding of these general constraints, and followed by we also discussing the importance of these general constraints and what are actually the design general constraints are there, and slowly we will move on to the case studies example how the medical devices is addressing these general constraints. Okay, so first we will start with the empathy perspective, that is what is the need of understanding these constraints. Since we are dealing with the medical device, these medical device is not like something normal electronic gadgets, because these device we are closely going to work it on the people. So even the small errors in medical device which will literally affect the patient care and also the quality of that medical device. So we have to be very much concerned when we are using such medical device on the patients. So that is the actual need here. So the patient and the clinicians, these are the two users which highly rely on these customers. If you see the patient perspectives, they depends on the service device for the safe care. And whereas if you see the clinicians, that is the doctors or who maybe, they trust the device because these device outputs or outcome which actually guide the treatment. So it highly plays important role in a clinical decisions which is used to given by clinicians. So these are the two users, they highly rely on medical device. So when you are making such medical device with some certain limitation, and which ensures the quality performance of medical device, that is actually it is a need to understand these constraints. So why this constraints is very important, as I said before, these are the medical device which without any compromise their compromise in their functionality, it has to work. So we have to design in a such a way to give a very accurate results and with a reliable performance. So that it will helps to avoid the risk when it is used on the patients, and also which is well used for or well suited for regulatory compliance or the safety standard compliance. Thereby these medical devices are meant to use for patients in a proper way. So here the constraints, okay, the thing is that the constraints is nothing but is a restriction. Here we are discussing about the general constraints or the boundaries or the limitation within which the device medical device should work. Beyond, if it goes beyond that or below that, there may be there may be like you can say the compromise in the quality, which directly or indirectly is going to affect the patient. So the impact of this medical device is very high if we are not considered these general constraints when we are designing this medical device. Is what is actually the design constraints. Okay, so when we want to design any sort of medical device, first we have to think what are the challenges or what are the boundaries or the limits which actually shape how the device can be built. So in such a way the device can give better performance for both clinicians and the patients. So there are so many limits. For example, you can see the electrical limits, mechanical limits, biological limits, and environmental limits. There is no specific constraints or restriction whatever aspects you are taking. If you are working on electrical component, or if you are working on mechanical component, or you are dealing with biological samples, so each and every aspects you have a limits, that is a boundaries. We have to work within that boundaries, not beyond that boundaries. It means there will be like losing their performance. So actually it gives a meaning of what device have to do and how safely it can do it. That is the actually what the design constraint is all about. So this is the essential boundaries especially used to for designing the medical device. It's not same like the other devices, like other electronic gadgets like mobile phone or laptop, or even clock. See that these are some sort of electronic device, but the thing is not same like medical device, because here we have to give so much importance, because these are the things which we are closely associated with the people, because we are going to apply directly or indirectly to the patient life. So the common general constraints when we talk about for medical devices, first we have to give more concern about the patient safety rules. And second one is the electrical isolation needs. So whatever device we are making, that has to be have separated isolation power supply. So in such a way you can avoid the leakage current and the limited signal strength from the body, because if you are taking any sort of biological signal from the body, all are in the range of very weak. It is almost in the range of millivolt. So it is very hard for the electronic components to process the signal in that range, so we have to give some sort of amplification process over there. So this can be considered as one of your general constraints, but it is which is not actually there in other electronic devices or electronic gadgets. So these are the three main things we have to focus. And other three main thing is like noises and interference issues, because the signals whatever you are taking from the body, it is like overlap with so many noises, because inside we have so many movements and we are taking the readings on over alive patient, alive people, they have tendency to move. So the motion artifacts and power line interference will literally affect the or literally distorted the quality of the signal what you are capturing. So that also found as a one kind of constraints when you are designing the medical device. And also the other two thing is material biocompatibility and size and the weight of the power limits. So material compatibility biocompatibility is nothing but whatever the electrodes or material you are going to place on your skin, where the material which you are having direct contact with the skin, we have to be like give more even more concern or focus when we are designing such a product, or we are designing such a thing, because the material what we are choosing, it should not cause any cause of irritation or any cause of discomfort to the people, in the respective of size or weight or even the the material what you are using. So these are the things it's mainly consider as your constraints in designing the medical device. Because we have to be very strong in this particular area. There should be no compromise in this particular area, in the especially the medical device. First we have to give the patient safety rules, that is we have to go with align in super align with the patient safety rules. And second one is we have to give electrical isolation needs in order to avoid any sort of leakage current, because even the milliamperes will leads to the cardiac shock. And third one is strengthening the signal biosignals. And fourth one is we have that will be superimposed with so many noise that we have to work on it. And last, choosing of material biocompatibility, that is a biocompatibility material. Last one, how big it is, that is like how small it is, the design aspect, that is size, weight and the power limits. In all these area we have to work very cleanly. So in next class, we will see a detail about what is general constraints with examples. Okay, with the real medical device examples. So thank you. Until then, bye bye.